Now, President Trump signed 2 bills aimed at lowering drug prices yesterday. Here's what he said about it. Roll tape.
In less than 2 years, we have taken unprecedented action to make health care more affordable and to give patients more choice and more control. The American people deserve a health care system that works for them, not one that takes advantage of them. And that's what's been happening, but we're changing that rapidly.
Joining us now, Health and Human Services Secretary Alex Azar. Secretary, thanks for joining us.
Glad to be with you. Thank you.
Let's talk about this. It's obviously a major problem, a major issue. Now, I know back in the summer, AP did a big survey after President Trump had discussed maybe some of these drug companies lowering their prices. In June and July, 395 drug prices actually went up. Only 24 went down. This is going to be a tough nut to crack.
Well, it's a complex system, and we've talked from the beginning about how we've got to change the entire system. But here are the results. Since the president announced his drug pricing blueprint and we've started taking action, there has been a 60% decrease in the number of brand price increases compared to the prior year. That's a real impact for patients, real savings.
What drug companies say is that it's a long process. You've got the FDA approvals of 1, 2, 3. You put in a new drug application, and you go through all the efficacy things. You finally get a drug, you put it on the market, and then at some point the generics may undercut you. So their window of opportunity after investing billions of dollars is so small. Is there something that can be done with the way the system is designed now to perhaps incentivize drug companies to keep prices at a certain level, a lower level, longer?
Well, that's exactly the right question. Right now, every incentive in the system is to increase the list price of the drug. Every player in the system makes more money if you increase the price because they're getting a percent of list price. So we've got to change those incentives. And that's what President Trump and I are working on, is how can we reverse those incentives? Because, listen, it's nice that 15 drug companies have cut their prices of their drugs or have reversed price increases or have committed to not increasing. But we're not counting on their goodwill or altruism long term. We've got to redesign this system to create the right incentives long term so this is enduring change.
Next one for you, Secretary. You wrote an op-ed on e-cigarettes this morning. I want to share with the audience the headline, quote, "We cannot let e-cigarettes become an on-ramp for teenage addiction." Sir, if you can, make your case.
I'm a parent of teenagers, and I am very disturbed by what I am seeing in terms of e-cigarette and vaping use among our teens. It is important that we have e-cigarettes available for people who are addicted to combustible tobacco products as an off-ramp for them because it's better than combustible tobacco. But we will not allow e-cigarettes and vaping to become an on-ramp for our youth to become addicted to nicotine and eventually using combustible tobacco products. And we will act with the full force of our authority to prevent that.
You know, when you go on Philip Morris's website, on their homepage, they say that their goal is a non-combustion product, that they're working toward that. And everyone says that's the future. And that there's some benefits, even with an e-cigarette, that perhaps these same teens would have gone straight to a cigarette. And so maybe there's some buffer there. Do you buy into that at all?
Well, we don't buy into any youth going in and using e-cigarettes or vaping and becoming addicted to nicotine. That's not right. There can't be marketing to them. And that's why we've asked the manufacturers of these products to come forward with an action plan to convince us that they have the ability to prevent youth from getting access to and becoming addicted to these e-cigarette products.
What are you looking for, them to get rid of like some of these flavors and some of these cute names? It's sort of like... everyone understands the things that sort of draw younger kids in. The Candy King we're showing on the screen right now. Can the government get them to do that?
So first off, we've gone after those manufacturers who have put products on the market that basically replicate candies and other products. So we've actually taken action against them. And then that's part of our process right now with the e-cigarette makers, is to look at all of their marketing practices. Are they doing anything to entice youth to find those products attractive? We've just seen in the last year alone a shocking increase in utilization and the pervasiveness of e-cigarettes by our teenagers, and we're not going to put up with that.
Secretary Azar, before I let you go, we talked about the branded drug prices. What about on the generic side? What's being done to make them more available?
Well, I've got some breaking news for you right here on the show. First ever announcement, which is that for fiscal year 2018, FDA approved the highest number of generic drugs ever in history. That's 971 generic drug approvals. 781 of those are full drug approvals. Another 190 are tentative approvals. And what's really important, 12% of those approvals were for complex, the difficult to make and construct generics like the EpiPen that we approved. So a huge advance for competition and lowering drug prices.
Hey, we always appreciate it when you come on, but we love it even more when you break great news like that. Secretary Azar, thank you very much.
Thank you.